All right, so I am Porter. I'm with Path Forward. We are a homeless services center in Arlington, Virginia, just in the courthouse area. And I'm very excited to be here today. So thank you, everybody. And I have to share that our President and CEO, Betsy France, she is also an alumni. So she is very excited that I'm participating in this. So she sends her regards. And I think she would love to be here next time to meet everybody. So that was also exciting for her. Just a quick fun fact. And then let me see, there we go. Okay. So I'm just going to give a quick overview of Path Forward, and then we will jump into our main topic, which is the relationship between homelessness and healthcare. So to start just quickly, our mission here at Path Forward is to transform lives by delivering housing solutions and pathways to stability. So when people think of homelessness, they immediately think of housing. So housing first is a really popular model. We are absolutely advocates of housing first. And if you haven't heard of housing first, that is very basically what it sounds like. So it's shown statistically that getting people into homes is the best for keeping them in homes. So that's usually our go-to, is trying to get people to find those housing solutions so that they have a stable place to live so that they can access those other services. However, people are not always on that same page. So when you think of homelessness, there's a very distinct difference between that and houselessness. So if you ever think about the minutia of the word home versus house, it's a very different feeling. Home is where the heart is. A lot of our clients really enjoy living on the streets. That's where their home is. Or I'm sure you have passed all of the tent villages. That's a home. It might look very different from my home or from yours, but this is a place that our clients find community. Some of them have jobs and some of them have PhDs, and this is just where they choose to live. So recognizing that, Path Forward really tries to provide that stability component, even if it's unrelated to housing. So in terms of outreach, we bring people resources, information, supplies, whether it's a bagged meal or a pair of new socks, anything that provides that stability in that person's own context, we're happy to provide those resources. So that's something to keep in mind. And the other thing is Path Forward's vision is an inclusive and equitable community where all neighbors live stable, secure, and independent lives free from the threat of homelessness. So at Path Forward, we service adult men and women. Everyone is welcome. So in order to receive services from Path Forward, you have to go through a Department of Human Services, so DHS. And once you are intaked through that system, you have to have been living within Arlington County for at least 90 days before you can successfully go through that intake process. And then depending on your situation, if you are a single adult male or female, you can come to Path Forward. In Arlington County, we have what Arlington calls it, a continuum of care. So we have other partners in the community. If you go to DHS and you are a woman or a man experiencing domestic violence, you might go to our community partner at Doorways. Or if you have a family, if you have children, you might go to our community partner, Bridges to Independence. So just like it's really difficult for one teacher to handle every single grade, we are kind of the same. We split up services depending on the demographics so that we can have the capacity to really provide for what people need. And then before I move on, does anybody remember ACE-BAN by show of Zoom hand? Does that ring a bell? Okay, so we were ACE-BAN and we were founded by Laura Rinker. She's a community member in Arlington just about 30 years ago. So our 30th anniversary is going to be next year in 2022. And she started then Arlington Street People's Assistance Network by providing meals right off of her porch to people experiencing homelessness. And during the pandemic, we had an opportunity. We tried to turn our lemons into lemonade, and we sat down and really tried to rethink what ACE-BAN looked like and give it a 30-year-old facelift. And so that's where Path Forward is born. And the other thing is a lot of people were confusing us for C-SPAN. So it was nice to move away from that and to something more concrete like Path Forward. So today we have our Homeless Services Center. So this is we're located right in Courthouse. We are literally right across the street from Arlington Courthouse, as well as the police department. And this is where we house all of our programs. So what's unique about this is we are able to provide wraparound services in one location. As you can imagine, if you don't have a home, your life suddenly becomes very transient. You're moving around a lot because you have to access different resources in different areas. Not everything is centralized. So that's what makes our HSC very different, is that we have everything in one spot. Additionally, we also have one apartment complex. This is in Westover, if you're familiar with the Arlington area. This is called Cybert House, and this is for our clients, which turn into residents that need a little bit of extra help. And so they are enrolled in our permanent supportive housing program. And so currently at Cybert House, we have about 14 residents who are staying there, and they just need a little extra help transitioning back into housing. And so we're able to have that case management there for each one of those clients so that they can stay in housing and then eventually move on to their own home out of Cybert House. And so here is our Path Forward's continuum of care. So I mentioned the continuum of care from Arlington County, but the continuum care internally at Path Forward is a little bit more local. So on the far left, we start with our street outreach that I mentioned earlier. And this is a unique service. Not all shelters provide street outreach just because of capacity reasons, but we have a suite of about 5 vehicles. And there you can see crouching in the picture is David Ordonez, and he is our street outreach as well as day program director. And David and his team, they go out at 4 in the morning, about 3 times a week. And they drive around, and David has been working here for quite a while and has a fabulous mental map of Arlington County. And he knows exactly where people are living in their tents, just outside in the open, or sometimes you see them at bus stops, stuff like that. So what David does is he loads up the van with a bunch of stuff. So if it's hypothermia season, which it is now, clothing that is warm, blankets, hand and feet warmers. Occasionally he'll be able to travel with some hot coffee, but we'll have water bottles, bagged meals, anything that some of our friends on the street need, he will bring them directly to them. Now, what's really integral about our street outreach, more than all of the stuff that we're bringing out to people, is in particular David and his team's relationship with our clients. David has spent years, and I'm talking maybe like 12 years, working with these clients who are choosing to be on the street. They don't want anything to do with our Homeless Services Center, which is fine. They'd rather see David maybe once or twice a week or less and have him hand over a pair of socks or just have a conversation. What's really important about that is David and his team have created a network of trust and relationships with our clients. So I'm sure, I've experienced it personally. I'm sure you have too. Sometimes walking by someone experiencing homelessness can be uncomfortable and sometimes hostile. There's a lot of survival mentality that our clients experience when they're on the street. And so having David and his team be consistent points of resources and positivity and also friendship, to be quite honest, is really helpful for people that don't have anything else. So that's really important. I always like to highlight street outreach as much as possible. And the other part of street outreach is that if you or your friends or your family or your business, if you're experiencing an interaction with someone who's experiencing homelessness, you're able to call David and he'll go out there. And I've got to say 9.9 times out of 10, he's already heard of that client and he knows exactly who it is and what they need. So he can go out there and provide services to them. So then if you move down to the Homeless Services Center, I touched on this a bit, but this is our 24/7 Homeless Services Center where anyone is welcome to come in at any time. We have our shelter monitors here 24/7. So if I tell the volunteers this all the time, if you really feel like donating a pair of new socks at 3 in the morning, you're welcome to. But this is more important for our clients. If they need socks at 3 in the morning, they can come in and grab them. So building that trust on the street with the street outreach team is what helps us with intake at the homeless services center. This is what actually brings people to the services center so that they can get those resources that they actually need and learn more about what it is that we provide for them or what their future could look like if they were to choose to come and receive services. So some of those services at our homeless services center include medical services, our shelter program, and our day program. So today we're going to talk a lot about our medical services, so I'm going to only touch on that really quickly. But we have 3 full-time medical professionals. We have a full-time nurse practitioner, as well as a full-time registered nurse, as well as a full-time medical assistant. So they are able to provide a full suite of everything that you can think of when you think of medical services for yourself. And we'll talk about that more in just a few moments. So moving on to our shelter program, this is what you think of when you think of a homeless services shelter. We don't call ourselves that because we have a lot more than just shelter, but it is something that's really integral to our programs. So typically throughout the year, we have roughly 55 shelter beds, and that is split up into 2 shelters on our 3rd floor. So a all women's shelter and an all men's shelter. And typically speaking, we have usually a 70-30 or a 60-40 split between men and women receiving our services. Currently, as I mentioned before, it's hypothermia season. That lasts from November to about early April in Northern Virginia. I'm from Rochester, New York, so our hypothermia season is a lot longer than that. But we are currently open with a lot of extra beds. So now, because of COVID-19, the one thing that has really changed for us during the pandemic is accommodating all of those beds in a way that's safe for congregate living. You see me without a mask here, but since it's 6:45, I'm the only one in the office, so I don't have to wear it. But we are still required to wear a mask. We are still required to do social distancing. And so that 6 feet rule is still very much in play. Every morning that I come in, I have to take my temperature and answer questions. Every morning or any time that clients come in, they have to take their temperature and answer questions. So with hypothermia, it becomes a dilemma because instead of 55 shelter beds, we now have 91. And so accommodating for all of those extra beds plus those 6 feet space requirements by the CDC is really difficult. But we've been able to manage. So we currently have, we are in a county building, and the county has given us a 7th floor. So it's the extra floor, and that's where we're able to have overflow from our usual shelter. And we are also partnering with a local Arlington hotel. And the hotel is really integral for us for overflow. So they are providing beds and rooms for our clients. And our full kitchen here makes the meals at our HSC, and then we cart them over to the hotel. So we're still trying to provide those services at the hotel. And at our HSC, we also have our day program. So this is still active. It changed only a little bit during COVID in the sense that we can't hold in-person events. So a lot of that is on hold for now. We will definitely be bringing that back because it's something that everyone really loves. But our day program includes a lot of things. So including our case management services, if clients need to come in and do laundry, they want to take a shower, if they just want to grab a meal. We have if you've ever taken a walk in the neighborhood and you see those like neighborhood free libraries, we kind of have that going on. People like to just relax. And especially now that it's cold outside, we have a lot more people that are not hanging out, but they're indoors more here at the Homeless Services Center. And which is great because that allows us to get to know them a little bit more. Especially people who aren't on street outreach. So people working at the shelter program or the day program, you're able to build those relationships and then point people in the right direction for other services. And lastly, as I mentioned with our housing solutions, we have both a rapid housing program as well as a permanent supportive housing program. So our rapid rehousing program is for people who are they feel a little bit more equipped to be independent to go back into housing. And so they're able to have a quicker turnaround in terms of going back into housing and staying in housing on their own. Our permanent supportive housing, that is the program where people may be either at Cybert House at our own apartment complex or at a bunch of other apartment complexes that are partners of ours within the Arlington community. And so they're able to access all of the services that we still provide, but through their case manager for a longer period of time until both the case manager and our client feel like they can start their life on their own and really seek that independence and stability in whatever context that means for them. Oh, yeah, so there's my star. We're going to focus on medical services now. So this is a really complex topic. So this is a really wicked problem. So I'm going to try and go through this as much as possible, and we will have time for discussion at the end. So there's a very complex relationship between social determinants of health and health inequities for people experiencing homelessness. So social determinants of health are the conditions where people live, work, and play, and that affect their physical, mental, and emotional health. So as I say that, you might think of some of the social determinants of health that affect your life. But if you are to think in the context of someone experiencing homelessness, your conditions where you live are strictly revolving around survival conditions. So it makes those impacts on your physical, mental, and emotional health a whole different ballgame from what you and I tend to experience. So there's a lot more anxiety, depression, substance abuse, even for people that you wouldn't even know were homeless around you. You don't know what they're going through because of those survival conditions that they have to experience 24/7. Another thing that I like to mention is a condition where I work. I don't have to worry about my safety when I go to sleep. And this is something that there's a big stigma with drug use in the homeless community. But one of our partners at Arlington County Police Department, something that he sees a lot of the time with our female clients that live on the street, never into drugs. That wasn't an issue for them in their life. It wasn't something that they were interested in. However, once they became homeless and were living on the street, staying awake increases your chances of survival and lack of harm. So if you fall asleep, there are greater threats of terrible things that we can all think about, either robbery, injury, rape, sexual abuse, the gamut. So if you're asleep, you have a greater chance of those things happening. Something that helps you stay awake is drugs and stimulants. So trying to have those survival conditions where you work or where you live now on the street, that's aided by stimulants and drugs. So that creates the attachment to drug use. That is not the case across the board, but that is something that his name is Mike Keene. He is a outreach worker with the Arlington County Police Department that he's seen from his years of experience. Another thing with health inequities is that healthcare is expensive. If you don't have anything in your pocket, that's a huge deterrent and a barrier for use, as well as it's sometimes far away. If you have no transportation or no way of paying for transportation, that's another barrier. And the last thing that a lot of people forget about is healthcare requires documentation and or insurance. So if you don't even have a photo ID, you're going to be barred from those services. So that creates a huge problem because a lot of our clients don't have those documentation reports or even insurance or let alone the monetary resources necessary to access those services. So another issue, this is also a huge one, is institutional supportive health care catalyzes first-time homelessness as well as perpetuates chronic homelessness, and that is included with injury and illness. So in homelessness, there is a concept called patient dumping. It's a crass way of looking at our healthcare system. However, a lot of times people who have perhaps gone through a pandemic and either lost their job and don't have family members, perhaps they fell ill, whether from COVID-19 or from an existing chronic illness, they need to access healthcare no matter what. So they're going to go and try their best to access that healthcare. But once they're discharged, they're essentially dumped on the street. So it's a really crass way of looking at our healthcare providers who do so much, but it's not their fault. It's this institutional support that doesn't exist once people are discharged. So a lot of people who go into a healthcare system without existing resources, and then they are discharged on the street, still with no resources, that catalyzes their first time experiencing homelessness. And you can imagine for people who are already experiencing homelessness, how that creates that positive feedback loop where you are constantly accessing services, but not seeing those services fed through or getting the root cause addressed. And so your injury or illness becomes worse, and then you have to access services again, and then you're discharged with no resources again, and on and on. Something that's really related to this is our barriers to access exacerbate forced overuse of emergency services. So for people who experience all of those barriers and difficulties that I just explained, their only option is the emergency room. If you can't afford an Uber, you're going to call 911 and you're going to get a ride to the emergency room from an ambulance, and you're not going to pay for it because it's going to be covered from taxpayer dollars. So this is also a fault of the system, where if you can't access just even going to your doctor for a simple finger infection, instead you have to go to the emergency room and incur all that cost that you can't pay for, it creates a big wicked problem. So there are studies, and I've provided a bunch of links at the end if you guys are curious to explore these more. There are a bunch of studies done where people experiencing homelessness use emergency services at a way higher rate than people who do not experience homelessness. So if you see this 43 and 100 number versus 203 by 100, people that are not experiencing homelessness, for every 100 of them, only 43 access emergency services, so the emergency room each year, whereas every 100 people experiencing homelessness, 203 access those emergency services each year. So it creates a huge wicked problem that causes strain on the capacity of the hospital system and the healthcare system, as well as institutions like Path Forward or our partners trying to alleviate that stress. Now, another fallout from this system is the cost. Who's paying for this? The CDC, as well as the National Alliance to End Homelessness, estimate that each person experiencing homelessness costs taxpayers $35,000 per year. This is a big wicked problem, and healthcare is not the only thing causing this cost, but it is definitely something that is a very large contributor to that, and it creates this wicked thing in each community across the United States. So that's a lot. That's a lot that's heavy and really difficult to manage, especially if you have nothing else. So for our clients, it causes a lot of emotional and also physical health issues just from these ideas alone. So what is something that Path Forward does to try and alleviate the stress from all those complexities? These are not root solutions. Effectively, they're Band-Aids, but we really try to do our best within the system that we're all living in now. So you'll see this is Kasha. She is our nurse practitioner, and she is awesome. So she, under her direction with her team, we provide medical respite programs, which is really important, particularly pertaining to what I was talking about with patient dumping. Say you go to the emergency room and you have, say you have a huge wound and you need surgery. Instead of being dumped onto the street without resources provided by the healthcare system at the hospital, you can come to Path Forward's medical respite program and recover here. So we have a suite, 6 medical respite suites that are fully hospital. It looks just like a hospital if you were to walk into it. And you're welcome to stay there and receive medical service care while you recover. And while you're there, you can build on that relationship with us. And if you want to access other services, you're already there and absolutely welcome to. Or once you've recovered, you can go back to wherever you'd like to go. We also provide primary and specialty care and prescription assistance. So really basic care that our clients don't have access to. And through that aspect of our medical services, in 2020 alone, we were able to help facilitate 810 medical visits for our clients. Vaccine, the hot topic of late. So we have always provided flu vaccines for our clients. And throughout COVID-19, under Kasha's amazing direction and connections, she has been able to secure, as of this morning, I asked our registered nurse, an 86% vaccination rate for our clients in shelter, which I find pretty awesome. So again, this is really through Kasha's work. Thank you. I appreciate the thumbs up, guys. This is really through Kasha's work and our outreach team, building those relationships and using a lot of community education and trying to meet people where they are to get that lens in their head that this is an option for them if they would like to seek it out. Client advocacy, as you can imagine, it can be really overwhelming if you're suddenly in the healthcare system with no resources and no idea what to do and no idea what to say yes to or what to say no to. So that's something that we provide. Chronic illness management, of course, we see a lot of issues, particularly with feet that are chronic. As you can imagine, if you're out in the elements and you're transient, so you're always on your feet and you're always exposed to the elements out there. Chronic illness management is huge. We also have community education and clinics. Our nurse just gave a CPR as well as a bloodborne pathogen training course, and we also provide Narcan training and distribution. And so that is to not only our clients, but also to our community partners as well, so that their staff is equipped in case of emergency. And then, of course, tying it back to housing, this is something just building those relationships through that medical services very often leads to housing. So another service that our medical services provide that I haven't touched on is our recently implemented mobile medical program. So this woman in the photo you see here is our registered nurse, Stephanie Funkhauser. She is also amazing and very good at her job. She was taken on in 2020, and we were able to enroll the medical mobile program live on the street. It's exactly what it sounds like. Just like street outreach goes out in our vehicles and brings resources to our clients on the street, Stephanie now joins, and she brings medical services that are equipped with wound care, foot care, chronic disease management, like I said, and she's able to deliver prescriptions on the spots to our client, like you see here, that are living out on the street. And the real goal of the mobile medical program is to strengthen our mission of meeting people right where they are, whether that's physically, emotionally, and now medically. So this is a tool for us to bring that access to our clients so that maybe they don't get caught up in those horrible complexities that I was talking about with our healthcare system. So this is Stephanie, as well as David Ordonez, who I mentioned earlier. So they go out about 3 times a week or so, and they also respond to community calls. So people like yourself who know about Path Forward and have the number, they give a call to Stephanie and say, hey, this person's feet look really swollen. I'm really concerned about them. Can someone go check on them? Stephanie's the one that goes out, and she does literally look like that when she goes out. That wasn't staged. So she is bringing everything with her just in case of any medical situation. And if something is extreme that she witnesses on the street, she's usually accompanied by David, and they're able to bring that person back to the center if they need further care, or they can move on to emergency services if that's really necessary. So to close this up, I have 2 stories that I'd really like to share. One of them is just very relevant, and then the other one is very dear to me. So the first story is a young client who was living on the streets in Arlington. He's a veteran. That's also a big, huge topic, but he approached Stephanie during one of her mobile medical outreach visits, and all he did was ask for a Band-Aid. And she's like, yeah, of course, I have Band-Aids, no problem. She checked him out, and upon further inspection, she realized what he had is something called popping skin. I apologize if you're screaming, I'm screaming too, but popping skin is what happens when you inject drugs direct into the skin rather directly into the vein. And so this is what he was experiencing that he wasn't aware of. So Stephanie said, hey, you need more than a Band-Aid. Would you be willing to come into the Homeless Services Center to get medical treatment? And after a few times of asking and building that relationship, he finally agreed and was more than happy to come in. He was able to receive treatment from both Stephanie as well as Kasha. And from that, once he had successful wound care, and after it was explained what was happening to him and why, he asked on his own volition for detox rehabilitation. And so Path Forward was able to connect him with our partner in the community for detox. He, as of this morning, he has successfully gone through it, and he is now enrolled in their 90-day recovery program. So this is what it's all about for us. Having that continuum of care available to that person in one place, if that's something that they're interested in. And so having that relationship is really important. And I'll move on a little bit to my favorite story. So as I said, I'm from Rochester, New York. I moved down to Arlington about a year ago. And for say once I moved down here, it was about 5 months where I didn't have a job. I wasn't in this position. And I would walk out into the community. I was down in Rosslyn at River Place, if anyone's familiar with that. And every time I walked out, there was a group of men experiencing homelessness where I'd always say hi to. And I got to know them over the course of those several months, and I got to learn more about their story. And they were just people that were fairly consistent in my life as I walked out in and out of my apartment complex. Now, when I came to Path Forward, I had the opportunity and was now connected to all these resources, and I was able to be an advocate for these 3 people experiencing homelessness. And one of those people in particular, he had a huge wound on his nose that was nasty. My boyfriend and I were monitoring him for several months. I was like, that thing is gross. It's not going away. Something is wrong. He needs help. But it wasn't up to us. It was up to him. So this particular man, after talking with him and us bringing up his nose, says, I've been street homeless for 6 years. I don't care at all about, at that time, ASPAN. I don't want their services. It's not for me. I was like, okay, that's fine. That's okay. A few weeks later, I had asked Kasha, I had told her about this man. And I said, listen, I still pass him on my walk to work every day. And it's just getting worse and worse. And I'm telling you, it was gross. It was very pussy. It was not looking good. It needed some help. And so I told her about it. And she said, okay, I'll go out. And so Kasha, being the lovely person that she is, she went out and met this man. And he finally, after several visits, said, okay, I know this is bad. I'm in a lot of pain and I will come in just for my nose. But once my nose is done, once that wound is done, I'm done. I'm not accessing other services. And Kasha said, that's fine. That's totally fine. We'll bring you in. We'll get you what you need and you can be on your way. So he came in, and it turns out that this giant wound on his nose was skin cancer, and it was spreading throughout his face. And so we were able, well, not we, I want to say Stephanie in particular, our nurse in this photo here, she was able to get him to a doctor and then to a specialist, and then finally to pro bono surgery removal and a 3-step repair. He starts his 3-step repair surgery this coming Friday, which is exciting. And the other thing is that since he's now in our medical respite program where he can receive recovery services instead of going back out onto the street, he is now asked to work on housing for himself. And so to me, that makes me really warm fuzzy because I feel like he was my first friend coming to a new place. But it's also something that he wasn't forced to do that. No matter how badly I was like, oh my God, you're sick, you need help. And I had like all these like mom feelings coming out. It was all up to him. And so he took those steps on his own because he was able to build that relationship, in particular with Stephanie, and see the kind of resources that he could still access independently and then find that stability on his own. That's one of my favorite stories. And it's also, all of these are just really relevant, which is awesome ever since the mobile medical program was able to get off the ground. So I wanted to share that with you guys. So we are just past 7. I do have a bunch of links and resources. I did tell Monique that I will send out the slide deck for you guys that you're welcome to access, just in case you're interested. But I would love to get any questions, any clarifications, anything that is on your mind, and we can open up the floor for discussion in any way possible.
Hello, this is
Hi.
Candace.
Hi,
really
Candace.
Enjoyed this presentation. I just want to, and also when you said it, I was like, I've actually sat across from, there's a little area with benches in front of the police station. So I think I've seen this building before.
Probably, yeah.
I just want to know, what do you do in situations where there are children experiencing homelessness? What does that look like?
Absolutely. So for Path Forward, we only service adults. So if there was a child involved, or if they were on the cusp, so a lot of times we do get some 18-year-olds or 19-year-olds, 21, what have you. If they're on the cusp, they are usually assessed by a case manager, and then we would put them in contact with our partner organizations. So Doorways, they are also Arlington local. They service anyone who has experienced domestic violence or sexual assault violence. And so if you're in that category, or if you need a safe home, you would be connected with Doorways. If you don't need those kinds of services and you are a family experiencing homelessness, no matter what age you are or how many children you have, what have you, you would likely go to Bridges to Independence. So those are our other partner, and they deal with families. So they have everything from child care, child education, volunteering opportunities with children, stuff like that. For Path Forward, we are only strictly adults. We just don't have the capacity to do it all. So that's why Arlington empowers all of these partners to stay in that continuum of care so that clients facing homelessness are able to receive the resources that they truly need. Does that answer your question, Candace?
Yes, it does. Thank you so much.
Yeah, thank you. Anybody else? Actually, I'm going to stop sharing so I can see more faces if you don't mind.
Porter, first of all, I just wanted to thank you very much for taking time out of your evening to talk to us. This was very informational and educational. And if I recall, I think it was Arlington Magazine had one of the reasons why my screen went black is because I was looking for it, because I always keep my magazines that are delivered to me, but it had a great article about Path Forward and about some other organizations in Arlington that help those that need it. My question is, what are some things that we can do either with our time, our treasure, or our talent? And I use that terminology because I'm in the development business to support Path Forward and the individuals that you help.
Thank you very much for that, Brian. I appreciate the kind words. And you are absolutely right about the Arlington Magazine. I encourage everyone to give it a Google. We had a really good time with the photo shoots with our clients for that article. In particular, Sheridan Jackson, she is a resident at Cybert House. She took a beautiful photo. She is currently working, we recently were donated a vegetable and flower garden in the back of Cybert House. And so there's a really pretty photo of her with right next to her work. So I encourage you to check it out. What you guys can do. Thank you so much for asking that question. Time, treasure, and talent. Currently, talent is really difficult for us because of our lack of ability to have in-person volunteering. We can't even have in-person events, so we're not having, the usual holiday stuff for our clients and stuff like that. So that barrier is very frustrating, both for us and then a lot of our volunteers. So talent is really difficult for us to use right now. However, I am always open to volunteer ideas that can be remotely safe. So if you have ideas that can engage groups or individuals, I'm always all ears to talk about that. In terms of your time, for the volunteer opportunities that we do have, they are all remote, but fully supported by Path Forward, and we really encourage you. So we have a decent amount of things. Our seminal volunteer activity is called our Homeless Bag Meal Program. So this is what I mentioned our founder started. She just made bagged meals and handed them out from her porch. That program is still going strong. So what you would do is, using your treasure, you would purchase all the supplies necessary to make at your home, in the safety of your own home or your friend's home, whatever, bagged meals, and then drop them off at our Homeless Services Center. And so we provide 3 meals a day, so breakfast, lunch, and dinner. And ideally this would be lunch, but it could also be dinner. And so this helps supplement our food program for all of our clients. So that's super helpful. We also have fundraising opportunities. So if you're interested in, I just got done with a slew of walkathons at schools. So if you're driving around Arlington at any given time, you might have seen 500 elementary kids walking around going, "End homelessness." It was awesome. But there are other fundraising opportunities for young professionals. So partnering with a local organization and maybe going out for a happy hour, having part of the proceeds donated, or including some sort of awareness and education event, very similar to what I'm doing with you now. Something like that is really helpful. We also have arts and crafts. This is something that we've tried to support throughout the pandemic because people want to keep their hands busy and also feel like they're connecting. So in light of the holidays, having generic, non-denominational holiday cards made for our clients is really great. If that's something that you're interested in, we have a lot of Girl Scout and Boy Scout troops that are working on that. And then for your treasure, donations are always helpful. So we have on our website at pathforwardva.org, we have a donation option. And so there are also different like segments of how much your donation is providing in terms of services. So we kind of translate it that way. So for instance, $10 is usually one meal per person. And then it goes all the way up from there. So it can provide clothing, or even just provide resources for a street outreach team to bring to people, as well as supplying monetary resources for our mobile medical program. So stuff like that. So I'd be happy to send to Monique, along with these slides, just a list of all of our remote volunteering activities, because that's really what we're pushing right now. And then we are hoping after the holidays, we have our Ambassadors Council, and that has been created of local Arlington young professionals. And it's not enrolled yet, but they are currently developing some more fun in-person events for everybody to attend. And we mean everybody. So we recently just hosted a beta with, you might be, if you're in the Arlington area, up in Ballston, 4040 Wilson and the View Apartments. We were able to partner with them, and they hosted a space, and they advertised to all their residents to come and make sandwiches for our homeless bag meal program. And we did just a quick informational, educational segment. And then we had everybody networking and mingling as they were making sandwiches. And they banged out, I think, 160 meals, which was awesome. And so once that event is done, it's our hope in the future that maybe they would go to a happy hour and just get to know each other in their community and stuff like that, while I cart all those 160 meals back here to make our chef really happy. So stuff like that is on the books, but not quite enrolled. So keep your eye out for that too.
Awesome. Thank you so much. It definitely sounds like there are plenty of opportunities for everyone to help out in a way that works for them, and whether their time commitment or financially or something like that.
Absolutely.
So, thank you.
Yeah, thank you for that question. I really appreciate it.
And Brian, I would just say we were hoping to do one of the in-person events and have everybody make sandwiches and things, but I don't know if you know, our Washington Center right now is in the midst of relocating. So we couldn't find kind of a place either right near Path Forward or there where we could kind of gather. So we'll hope to do something like that in the future also, but that's why we're learning about it today virtually, which we really appreciate Porter coming to tell us about.
Yeah, I'm excited I know the struggle for the in-person stuff, whether you're moving or the pandemic. So we're here to support you when you guys are ready, for sure. Anything else on anybody's minds? We've got a few more minutes to pass the time.
I have a question, and I admit I work in health, so I may have a little more targeted question, but was really excited to hear kind of about the services you have and know how valuable it is to have that kind of trusted connection. Was wondering how you all kind of fund things like your clinic, and you might have told us a little bit, but when you mentioned working with your colleague or your friend who is a veteran, are you working kind of with the VA or Medicaid? I assume most people would qualify for Medicaid. Like, how do you all kind of work with reimbursement versus volunteer dollars?
Yes, yeah. So a lot of that comes through our case management, especially with veteran services. So we do have partners in the Arlington community that we're able to connect those services to our clients where it's appropriate. So a lot of that happens through our case management. Otherwise, it's a lot of grants. So those are able to keep everything up and running as any development department would. And it's also utilizing that continuum of care through Arlington. So having that full suite of services here is great, but if there's something that we can't offer, it's really helpful to have that hand-holding and support from those other organizations where we have deep relationships with, because it's facilitated as one continuum. And so we're able to reach out and pull in those services from other places. So for instance, that veteran, we don't offer detox here. It's just not within our capacity and it's not our specialty, but providing that service from one of our partners and still being able to support him while he's getting those services from that other organization is really useful, both for our clients and for us, because we're able to keep those relationships going even when they're not physically here in the Homeless Services Center. So it's not just one answer for that question. There's a bunch of different resources that we're pulling at one time, and it's really facilitated by our case managers. Does that answer a little bit of your question?
No, it definitely does. And I was also just going to say, I totally appreciate you talking about the social determinants of health. So
yes,
keep going with that. That was great.
Big thing. Yeah. So I do encourage you guys to check that out. It's really important. And if you are interested in social determinants of health, I do encourage you to Google Samaritan. This is an organization in Seattle. I will include this too in case you're interested, but they are working on really interesting initiatives based on social determinants of health by utilizing Bluetooth and an app. So when you walk by people on the street, no one has cash anymore. I never have cash. And so and also as a side note, it's really difficult to give cash to someone experiencing homelessness because there are so many stigmas and you don't know where it's going. So instead of doing that, they've developed an app, and the homeless person would have a fob, and through Bluetooth, if you're in a certain radius, the fob would ping your app on your phone, and you're either able to donate to the organization that houses their case manager, that particular person, or you can chat them. You can say, hey, how are you? Like, my name is Porter and I see that you're homeless. Can you tell me about your story? And you can create that sense of community through an app that's facilitated with their case manager. Or you can donate monetarily directly to them, and that money stays in the cloud. They never see cash. And so what Samaritan does is they partner with local organizations such as barbers, grocery stores, stuff like that. And this person can use their fob to virtually deduct that money from the cloud to access services. So like a haircut or groceries or stuff like that. So it's super fascinating. That's something, a passion project of mine. So I will include that too, because I just think it's really interesting. But thank you for noting that. And thanks for your question, Angie.
I guess a semi-related question. How do you all handle prescription access? So for the people who maybe had procedures, now you need antibiotics and painkillers, maybe more specific medications. So is that something a case manager would also handle, or how do you all go about that?
Sure. Yeah, great question. So this is really a partnership with the case managers and our medical team. So our medical assistant, we have a full suite of prescription services and standing orders, stuff like that, even the stuff that is a little bit stronger. So all the regulated over-the-counter stuff they deal with. So that is really a part of our Respite program. So if you're requiring those higher prescriptions that take a lot more care, or they are very specific to whatever injury or illness that you had experienced, that's going to be closely related with Kasha, our nurse practitioner, as well as Sarah Akisi, our medical assistant. And so they will work very closely with the client, as well as very closely with that client's case manager. So the medical services part of it with our nurse practitioner is very much explaining the side effects, how you need to take it, why you need to take it, anything related to your physiology. And then with our case manager, it's passed over, well, if you need to take this prescription 2 times a day, your case manager is going to be asking you if you're actually doing that. Or how are you feeling while you've been recovering with this particular prescription? And so that's a lot easier with our clients that are in shelter, but we do offer that service through the mobile medical program to clients on the street as well. So a lot of times there are foot injuries that are open wound care and that require antibiotics due to infection. That's something that we can take those antibiotics directly to that person, even if they don't want to come into the center. So trying to expand that access to those essential prescriptions for people so that they can make a full recovery is a goal of ours. Does that answer your question?
Yes, it does. Thank you so much.
Okay. Sure. Thanks, Monique. And Angie, thank you for the, I appreciate the link. So this is the link that Angie just threw in the chat. This is the article for Arlington Magazine that Brian mentioned. So this features Path Forward, but also Doorways that I mentioned, Bridges to Independence, Arlington Thrive. It's a really great article. I really encourage you to check it out. And if not for the photos alone, they're just very joyful for me.
The picture in the garden is really pretty, you're right.
Yes. Yeah, I'm so happy she was able to be featured in her happy place.
Just out of curiosity, you mentioned like a few times in different situations, people may not want to go into the shelter. They may not want to go directly into, the area to receive care. What are some of the reasons you've heard from people as to why they don't necessarily want to come in?
Sure, it ranges wildly. So I'll tell a story from my hometown in Rochester. I was very active in terms of volunteering. We had a village, if you will, of a bunch of tents where people experiencing homelessness lived. And I would often go out there with meals or donations and just to get to know everybody. One man, he called himself Tex. He loved living there. He hated the idea of working a full-time job. He hated the idea of that confinement in the society that we currently live in. It wasn't his jam. He's gone to college. He's done a lot of the things that you and I have done that you might see as something as productive. He has just redefined productivity for himself. And so he, our mayor called the village Peace Village, and he hates that. And so he calls his village On Skids Row in honor of all of the people experiencing homelessness in Los Angeles. So if you know of the original Skids Row. So he calls himself the Skid. He loves it. That's his culture. That's where he finds his community with sometimes people who are transient and go in and out of the village. Some people who are like him and have been living there for over 10 years. He can play a killer tune on the ukulele. He is very, very kind, and he has a particular interest in petting all the dogs that he sees on the street. So he's just like you and I, but his definitions of how he wants to live his life and how he wants to experience life are very different than what we might often think of as the status quo. Other reasons, mental illness is a really big thing that we experience, whether that was something that existed before they were street homeless or something that they developed over time. This is something that causes a lot of trust issues and barriers, especially because a lot of the services that Path Forward provides does very intimately handle finances for our clients. That creates a lot of distrust when you're not seeing your money, but your case manager is. And so a lot of that mental illness does create some of those barriers for coming in and accessing those services and being like, well, I want to have full control of my Social Security check or my disability check. I don't want anybody to touch that. And if I were to come into Path Forward, they would be handling my money and not me. And I don't like that. And a lot of people have that. I don't want my brother to be handling my finances. That's a totally different situation, but that's my independence. And so if I were needing other resources that included financial management and I was distrustful of that, I wouldn't take it because that would be, in my opinion, taking away a part of my independence. So we try to respect that. And so maybe there are other services. It's like, hey, we don't need to see your paycheck, but do you want a shower or do you want, something else? You're able to pick and choose to a certain extent. We are not a 5-star hotel in any sense of the word, but we do try to really treat people with that dignity and respect that you and I would treat each other in whatever context that meant for our friends on the street.
Okay, yes, that makes a lot of sense. Thank you so much. And we have about 5 minutes. So does anyone else have any lingering questions? We can take one more. Okay, if there's no other questions, thank you so much, Porter, for joining us tonight. I really learned so much, and I'm so grateful that you came and spoke with us tonight. We really would love to work with you all in the future. So hopefully soon we can do something in person or maybe another educational event, just whatever people are interested in. So thank you so much.
Thank you guys. I really appreciate your time and hanging in with me on the evening. So I appreciate you guys coming for information and awareness, and I hope you're able to take that to your friends and family in the community so that they can learn as well. And like I said, I will send Monique and Angie a follow-up so that you guys can have the slides, you'll have my contact information, as well as just some more information on our volunteering and stuff like that. So feel free to give me a shout whenever.
Yes, thank you so much.
Thanks, guys.
Yes. Did you have anything, Angie? I just saw you went off mute.
No, I was just going to say that also thanks so much to your William and Mary founder. So please tell her that we really enjoyed learning more about it.
She's going to be very excited that this is now a topic of conversation. So she'll love to meet you guys in the future. Absolutely. She was very excited when I was like, hey, this is William and Mary. She's like, oh my God, that's my alumni. So it was a big deal. So thank you guys. I appreciate the opportunity. It was very nice to meet you all.
Yes, so nice to meet you. I'll send all that information out tomorrow, and then once I get everything from Porter, and if you guys have any other questions, feel free to send an email.
Awesome. Thanks, guys.
All right. Have a good night, everyone.
Thank you. Good night.
You too.
Thank you so much.